It worked.
Yay. Looks like people are starting to join. So welcome everybody. We're going to get started probably in about 4 or 5 minutes. Cameron and Beth, do we want to have people introduce themselves in the chat maybe? Be kind of fun to see where people are logging in from maybe.
Yeah.
That's a great idea.
That sounds good.
So if you are just logging in, feel free to introduce yourself in the chat area and you can let us know where you're logging in from. I'm sharing my screen, so I won't see the chat, but Beth and Cameron will be keeping an eye out and we'll get started here in just a couple minutes. Welcome all. If you guys are just joining us, we're going to get started in just a couple minutes. And feel free to introduce yourself in the chat area. And I'm going to shut my other door because my phone keeps ringing. Hang on.
Thanks for introducing yourselves. Looks like we have a excellent array of people from across the country.
Yeah.
Nice geographic representation. Thanks for coming today.
Dangers of working from home when your husband is off. He's also a loud phone talker. Shh, don't tell him I said that. So welcome everyone. We've got just a couple minutes before we get started today, but feel free to use the chat to introduce yourself. It's always kind of fun to see where people are logging in from.
It's exciting. We have a social work intern here today. So thank you for joining us, Maddie.
Social work intern can tell us whenever we're wrong during today's session.
Well, Pennsylvania is particularly well represented here today.
Nice.
Yeah. But yeah, very nice geographic representation from all over the country.
So just about another minute. We'll start right at the top of the hour. So good afternoon, at least good afternoon in Colorado time, which is where we are starting from. We're going to go ahead and get started with today's session. In 2018, there were 2.5 times more suicides in the United States than homicides.
Suicide is the second largest cause of death for young adults aged 10 to 24 in the United States.
In 2019, 18.8% of high school students seriously considered attempting suicide, and 8.9% did attempt suicide.
So welcome and for joining us for Welcome to Teen Mental Health in Their Own Words. My name is Kreger, and I am the Professional Development Consultant for the Colorado State Library.
My name is Cameron Riesenberger. I'm a Senior Librarian in the Young Adult Services Department at the Pikes Peak Library District in Colorado Springs.
And I'm Beth, Crist, Youth and Family Services Consultant at the Colorado State Library.
So as you can see from our headlines on the slide and the stats that we just gave, teen suicide is a growing problem nationwide, and the community impact of youth suicides is profound, with far-reaching social and emotional effects. And the libraries in which we work are a critical part of the communities that this is affecting. So our goal today is really to bring awareness to the teen mental health and teen suicide. We're going to share a little bit of research and to try to brainstorm ways that libraries can help affect change. We do want to say at the outset that we by no means feel that libraries and library staff will or should solve the problem of teen suicide in the United States. Rather, we're really hoping that we can be part of the larger community conversations. That said, we're going to be spending time today reflecting, sharing, and brainstorming. There may be some things that we see here or talk about today that you might find triggering, and we will not be offended if at any time you need to step away for a few moments. We are using a different Zoom setup today, so please post any questions in the Q&A, and we will try to address those as we go. However, we're going to also be using the chat feature for some activities as we go through. When you use the chat feature, just make sure that you send messages to all panelists and attendees. It might be defaulting to just send it to just sending to the panelists, but if it's something that you would like to have all attendees see, make sure to change that. We also do have a handout for today's session with resources. It is a Google Doc that will allow you to make your own copy of the resource list, and I'm going to have Beth pop that into chat for me. If by chance you have trouble accessing the Google Doc document, or you don't do Google Docs, or your institution won't let you do Google, at the end of the session, we will be sharing our contact information, and we'd be more than happy to send you a copy. So we're going to go ahead and dive in.
So I'm going to start out talking about some statistics here about the extent of this issue and how it's been increasing in the US. As you can see from this chart here, this is from the CDC. And as you can see from the chart and the headlines also in the previous slide, youth suicide rates have been increasing nationwide, increasing 57.4% from 2007 to 2018, which is the most current data available from the CDC. The prevalence of attempting suicide among adolescents is higher in females, although males are more likely to die by suicide. Also, teens who identified as LGBTQ, and American Indian and Alaska Native youth, who have by far the highest suicide rate of any racial or ethnic demographic group. And the reasons for this are complex, and they're really not completely understood both before and during the pandemic, and they involve layers of risk factors, including biological and environmental ones. And about the pandemic, there are no nationwide statistics on suicide deaths in 2020 yet. That usually takes about a year to get that data. And researchers have yet to clearly link recent suicides to the pandemic. However, according to the CDC, between April and October 2020, hospital ER visits did see a rise in the share of total youth visits for mental health. Compared with 2019, the proportion of mental health related visits for youth 12 to 17 increased about 31%. And it is important to acknowledge that suicide, again, is a complicated issue and is never caused by just one thing. So pinning suicide attempts on school closures, screen time, or lack of sports or after school activities alone does fail to address the larger issue. And it also really overlooks many critical opportunities that we can use to help stem the growing problem. Next slide. And here is a breakdown by the states, each state. And this is a chart again from the CDC. And it shows there's really a lot of variation across the country in suicide death rates for this age group. But from 2016 to 2018, suicide rates increased significantly in 42 states. So this is definitely a national concern. And we do encourage you to look at CDC data for your state to see what the statistics are there and what the rates of increase are there. Next slide. Okay, we're going to take a look at a video clip here in a minute. But first I wanted to introduce these two documentaries. These are both excellent, excellent documentaries that give a glimpse into what teens with mental health issues face and how adults can help. What I really love about both these documentaries is both are entirely teens speaking. There are no adults. It's all firsthand accounts from teens, firsthand, direct. They can be really tough to listen to, but they're also really inspiring, and they provide a lot of rich insight into how library staff can help these teens who are suffering from mental health issues. We're going to watch a clip from the first documentary, You're Not Alone, which was produced by PBS, and this is freely available online at the website listed on the handout. And this one even comes with a toolkit for further exploration and discussion. So the second documentary here, The Not Alone, we're not going to be looking at today, but we did want to feature it. A teenager initiated this one after she lost a close friend to suicide, as she was moved to raise awareness on the topic to help prevent additional suicides. It is available online for purchase and through several streaming outlets. And we really encourage you to watch all of both. Again, they are very, very powerful, and they do really let you hear firsthand what these teens are dealing with. So Christine will play a clip from the Kids in Crisis You're Not Alone documentary right now.
All right, so I'm going to stop sharing and go to the right thing. We always keep fingers crossed. Okay, are you guys seeing the video now, Beth? Is it on the screen?
Yes.
Okay.
Mm-hmm. People thought I was a monster. I was born addicted to heroin. When I was only 3, that I was sexually assaulted.
I'm being bullied for my autism at school. I was being bullied for it. They would say I'm ugly, I'm stupid, I'm a nerd, I'm a dork. I wrote a goodbye note when I was 7 years old. The first time the suicide idea popped into my head was in middle school. Being isolated definitely led to a lot of depression, and it just made me very anxious to be different. I heard the whispers behind me. It was hard to walk down the hallways alone. I did it all day, every day.
I think a lot of trans students especially suffer from so much mental health because it's not always an open place in schools to be who you are. It adds another layer of difficulty if you're kind of going through something that not a lot of people understand. I'm TJ Esser, and as a transgender person, I've experienced anxiety because society has tried to make me someone I'm not.
I'm Reina Saldana, and I've experienced depression, bipolar disorder, and post-traumatic stress disorder.
My name is Alex Hartwell-Pendo, and I dealt with bullying.
My name's Barrett Petker. I live with depression, anxiety, and obsessive compulsive disorder.
We're here
To tell you
That you're not
Alone.
Okay, yeah, pretty powerful. And again, if you ever do need to step away during this hour, please do so. And we are interested, though, if you're able to get your impressions of that. We have some questions here, and just type your answers in the chat. What are your first thoughts after hearing from these teens directly? Did anything surprise you? And what implications for your library services arose for you? We'll just have a discussion here in the chat for a few minutes about this. Yeah, Kathy, how young some of these kids are. I mean, the one boy who said he wrote the note when he was 7. It's just devastating. Frustration with the systems that have failed them. Absolutely. Yeah, again, the age. And it is good to just be reminded of all that teens carry with them. This is a hard burden every day that they face. How frank they were with their experiences is, yeah, it's true. They want to talk about this stuff. It's the adults who often don't, right? Good insight. You want the library to be a safe place for these teens, absolutely. How they were able to identify how they were feeling, yeah. You want them to know what systems are available in the community. And frustrating that society is not as accepting, right? So some of these are very large societal issues. Yeah, the multiple kids with different identities. And if you watch both of these documentaries, you'll get lots of different voices. Watching them two side by side, like at the same time, right back to back, is really powerful. You will hear from a lot of teens speaking directly about their experiences. So, oh, Teresa, that's lovely. Find them and tell them to come to the library where they'll be welcome. Yeah, that's great. And provide safer spaces and connections, resource supports. Yeah, and they are mature and brave to be able to speak about this. They really put themselves out there for both of these documentaries. It must have been really challenging. Anti-bullying efforts, not helping much. Yeah, courageousness, heartbreaking, bullying and isolation. Yeah. So these are great insights that you've shared. These are so powerful. Thank you. Christine went back to the slide that shows them, and the links to both of them are available on that resource handout that we shared out. So, so do visit those. We encourage you to, and we hope that hearing from these teens directly too will kind of help shape the rest of the hour. Let's see, we've had some more comments here. Yeah, that's great. Just such rich insights here that you're sharing. Oh, yes, we don't have people like that here. Well, yeah, you do, right? You're exactly right. Yeah. And Heather says it makes you eager to reopen the library. It really does. Yes, absolutely. Well, thank you so much for sharing. And it wasn't easy to watch or share perhaps, but we appreciate it. All right, and over to you, Christine.
All right. So once again, we do thank everybody for sharing kind of their thoughts about the video, and once again, kind of being willing to jump into conversations about this difficult topic. We're going to switch gears a little bit and talk about some Colorado specific research. And we do realize we're talking to a national audience, but I think what we're going to uncover is applicable nationwide, even though the research itself that we're looking at briefly is from Colorado. So, and this report is in your handout as well. In December 2017, the Colorado Office of the Attorney General's Office of Community Engagement, that is a mouthful, hired health management associates to study specifically 4 counties in the state that had experienced recent suicide clusters among middle and high school aged youth, and who had historically high rates of suicide across every age group. So those counties were El Paso, Pueblo, Mesa, I knew I was going to do that, Mesa, and La Plata. They collected data through a variety of means, interviews, focus groups, including teen focus groups. They reviewed information on current suicide prevention activities and resources in those 4 counties and then across Colorado as a whole. They reviewed both traditional and social media coverage related to suicides, once again, in those 4 counties and across Colorado. And they reviewed publicly available information on school policies and procedures related to suicide intervention, prevention, and postvention. So this research led to the creation of the report that is in your handout entitled Community Conversations to Inform Youth Suicide Prevention, a Study in Youth Suicide in 4 Colorado Counties. The report itself is about 80 pages, well worth a read, even if you're not in Colorado, because once again, they're talking about things that are applicable, I think, nationwide. The report was released in 2019 based on 2017 data, and it has not been updated. But according to the report, since 2009, Colorado specifically has seen almost a yearly increase in suicide. Other notable facts were that more females actually attempt suicide, but more males are actually dying by suicide. They had some data from the 2017 Healthy Kids Colorado survey that indicated that 17% of all middle and high school age students reported considering suicide, and 7% reported making at least 1 or more suicide attempts in the previous 12 months. But, and you're going to hear us say this several times, when it came to LGBTQ plus youth, the numbers rise to 44.8% reported considering suicide and 19.9% attempted suicide in the previous 12 months. In addition to describing how the data was gathered, key findings covered things like risk factors and barriers, facilitators and protective factors, and some recommendations, which we're going to talk about in just a moment. And once again, these may differ from county to county, but what we did is we pulled some high-level information, which we're going to talk about in just a moment. And I think Beth had kind of covered that we don't really have numbers from the CDC yet for 2020, but they are starting to see, at least in the emergency rooms or other facilities, that there's more reporting of mental health issues among youth. So that's something to keep in mind. So I do apologize for this huge wall of text here. I tried to think of like various ways to show the stuff, but basically these are bullet points indicating risk factors that we pulled out of the report. So we're going to give you just a minute or two to sort of read through this. And then in the chat area, like anything that you see that strikes you, questions, I don't know, just kind of want you to sort of take in the information when we're talking about the risk factors for youth. And I'm going to have Beth and Cameron monitor the chat for me. But do feel free to take a minute to just kind of read it through.
Yeah, we have some comments about how the pandemic raises these factors, these risk factors in teens.
Yeah, definitely. I think it could almost impact all of them, really. Lack of health insurance, they don't have access to some of the same activities that they had before. Yeah.
One comment here is, it seems like we know that lots of stress impacts kids, but our schools and society keep expecting more and more, and it's hard to balance and juggle that. Mm-hmm. Great point.
Mm-hmm. Yeah, that's a very astute point. And just thinking back to even when I was a teenager, and in a lot of ways the pressures were not as intense. We didn't have social media and some of those other things that can kind of exacerbate things, but it's, I still remember feeling, especially school pressure and those kinds of things that, I don't know, and then it turns into work pressure. Maybe there's things that all of us can learn from this.
Great comments about systemic issues, like poor employment, lack of health insurance, etc. Even lack of access to mental health care at all. Another comment is the Western mentality of solving your own problems is so true.
Yes.
And also a regional economic thing too. And I
Mhm.
will add, please, when you're posting your comments, post it to all panelists and attendees. I know it defaults to all panelists. And so those are only coming into the panelists. So we do have a question. Can you explain this point, teen suicide becoming normalized?
Almost like I think what they mean by that is that it's kind of like anything else that you kind of hear on the news and stuff. I kind of liken it in the same way to sort of what we hear about kind of like gun incidents and stuff, that it just happens over and over and over, and it gets very sensitized in the news so that it's not shocking anymore, I guess, is where they're kind of going with that. It's not necessarily a surprise, and after a while you just sort of get desensitized to it, so then maybe there's not a strong call to action, even though it's devastating, obviously, for the families, devastating for the community in which it happens. Hopefully that answered your question okay.
Just to add to that, I've also seen, and I'll talk a little bit about this in my section about one of the groups I work on, but part of it being normalized is that that is the thing that they see online to jump to when there's any kind of difficulty, like a breakup or a bad test score. Like it was parents or teachers seeing like the immediate next step for these teens was thinking about suicide, rather than it's just kind of collapsed that gap between all of these other steps that we maybe have been used to in the past when you've seen young people encounter difficulties.
Thanks, Cameron. Okay, so I think if there's no more comments or questions, we're going to move on to protective factors. So once again, basically, these are protective factors that were pulled out of that report. And once again, take a minute just to kind of read it over and post your thoughts in the chat.
And we received so many great comments from the last slide. Thank you all for sharing. It's really, really great insights and a lot of empathy.
So what sort of things are popping into your mind as we're looking at the protective factors, factors that might, help youth not to attempt suicide or go down that road?
So we're having some discussion around adults who work with youth being scared off of having open discussions with students because they fear parent reprisal.
Yeah,
a lot of people have agreed with that.
Yeah, that's an astute point. I mean, it's like we know we need to have some of these hard conversations, and yet what is the role of somebody who isn't the parent? What is the role, how far does that go? One of the things that kind of popped into my mind is that we had, the wall of text on the last one in terms of risk factors, and we've got 5 sentences here in terms of protective factors. Now, these are still broad protective factors, but we don't have the same big list to pick from. So that's also something that I noticed. Anything else about protective factors?
Well, one I noticed is access to extracurricular activities, which has not been available for the last year for the most part. So
yeah.
But yeah, we're getting so many great comments in the chat too. One great comment here is, I think one thing about the protective factors is you need all of them.
Yes.
It's not just one.
Yes, and that really speaks to, once again, not expecting the library to come in and solve this problem. I mean, in a way that would be awesome, but that puts way too much pressure on the library. We need the community, we need everybody, and so I really like that point about they need to have access to multiple levels, multiple touch points, multiple kind of things. Anything else before we move on and look at some of the recommendations from the report?
Yeah, I'll just mention one other comment, that even though some of these resources might be available in a community, they're not always delivered in cultural relevant ways. So that is a great point. A lot of people are agreeing to that.
Yeah. No, you guys, this is great stuff. Great. I mean, hard to think about, but really kind of great to kind of dig deep in. So the last slide that I have for you here is, these are, I think they actually had like 10 or 11 recommendations from the report. These were ones that at least we three felt potentially could align with what libraries offer. And so that's what we'd like to have you do right now, is take a look at these recommendations, and in the chat, maybe list the number. I won't make you type everything out, excuse me, but list the number that you think might align with what libraries offer. And then if you feel like expounding upon that a little bit, and once again, I'll give you just a little bit of time to read through. So are there items in this list that you think can align with maybe your library's mission or goals or services that you guys already provide?
People have brought up 1 through 4.
Okay. Prioritizing relationships between adults and youth. Culture of support, and obviously that's very broad, but that can look like a variety of things.
We also had a mention. Oh, sorry, we've also had a mention of number 6.
Yes, making taking, instead of coming up with your own campaigns and stuff, making use of what is already out there, and helping to destigmatize getting mental health. I think a lot of what especially when it comes to youth programs and that kind of stuff, that's, I think, hits number 4, as people had said, the pro-social activities and supportive environments. But I think, perhaps, even programming on building resilience and coping skills, once again, from a community perspective versus, go teens and be resilient on your own. I don't think that that's necessarily helpful, but anything else?
Oh, so many. It's great. Just an amazing chat here.
I wish I could see it.
We'll have to save it. Yeah, there's a lot about number 7. Oh, this is great. Number 6, one library creates self-care kits for teens and adults.
Oh, that's awesome.
Several people are bringing up that May is Mental Health Awareness Month.
Yeah, so I think there's and I think what Cameron's going to be touching on next might give you guys ideas for how you might be able to incorporate Mental Health Month into your library. Anything else before we move on? We know that, it's kind of a lot of thinking and reflecting that we're asking you guys to do.
There was one comment that libraries, I'm trying to find it now, I've lost it. There's so many coming in. Here, the only ones that aren't really in the wheelhouse of libraries are 5 and 8.
5 and 8. Yes, it would be hard for us to increase funding in a lot of respects, perhaps like grant projects and that kind of stuff. And it's probably not in our wheelhouse in terms of training media professionals on how to cover suicide safely. However, maybe you could help provide resources to media professionals who are looking to do program, information on suicide and suicide prevention and providing resources. I think in a lot of ways, maybe if we were partners with the media in terms of doing some of the research, that would be good, but maybe that's going beyond the scope of libraries at this point. Anything else before we move on, Beth? I think we're going to be very eager to hear what Cameron has to say.
Yeah.
All right. So Cameron, I'm going to turn it over to you, and do tell me when to move on to the next slide. Okay, Cameron?
All right. Okay. So we've thrown a lot of stuff at you already today. Some of it's been pretty heavy. And like we said at the top, we don't expect you to become experts in this field or to solve the problem, for your entire community from the library. But there are definitely things you can do in your library to support teens and to support their mental health needs through your work. And I'm going to talk a bit about some of the things that we do at the Pikes Peak Library District to support teen mental health. And hopefully there's something in here that would work for you. I've kind of scaled them from easiest to most complicated. Yeah, hopefully there's something, or maybe there's something that you're already doing, which is a great sign. Yeah, let's go ahead on to the next slide. The first thing to offer, because as librarians and library staff, we are information professionals, kind of the first thing that you should think about is providing information resources to your patrons. So we have a couple examples on the screen right now of some of the handouts that we have at PPLD. The two images on the left might look familiar. Yeah, I've seen it in a lot of libraries. It's this Tough Topics for Teens bookmark. And on the one side, it has subject headings for different situations teens might be dealing with, addiction, depression, gender identity, and then along with the call number ranges for those subjects in the stacks. So that if a teen is maybe uncomfortable asking somebody like where to find a book about addiction, they could have this handout and they could find it in the stacks themselves. It also includes a note on the bottom of the bookmark in that blue box that librarians are very protective of privacy and we're non-judgmental about what you're checking out or what you're asking. And that if you need help, you can ask us. And that we also offer self-checkouts at the library, all of our libraries. So they could kind of go to start to finish finding a book without having to talk to anybody if they're uncomfortable, but also kind of signaling that, we're here to help whatever your issue is. And then on the reverse side of that handout, we just list both local and national phone numbers for youth serving organizations or crisis text lines, or just different organizations that are there to support teens. And then the two images on the right side of the page, those are both examples of book lists that we offer. So one of them is more informational books, just to highlight some of the things from our collection. And the one on the very far right is mental health focused YA fiction, because as important as informational books are, I think we'd all probably have experienced something where there's nothing quite as helpful as seeing yourself reflected in a book that you're reading. So having both of those is great. We've used these for displays before, like in Suicide Prevention Month or Mental Health Awareness Month. And we've just stuck the handouts in the books like a bookstore would with a bookmark, and hopefully they take that along with them. If you want to take some informational resources a little bit further, you can do something like what we have on the next slide. And this is mostly just a more in-depth version of that first Tough Topics for Teens handout. This is a subject guide I built for our website. We use LibGuides at PPLD, but you might have a space on your website where you can put something like this. And in the blue boxes on the left, you can navigate to the different different subjects again. On each page, you'll have something like an informational video, as well as links to other articles. And again, contact information for those local organizations where they can get direct help as they need it. And this is, I think, is an area where I could definitely improve some of our informational resources, as I haven't added anything to this during the pandemic. And I think there are ways to add more information about, isolation or, being kind of cut off from the normal life and the grief that they might feel from that. So there's always ways to continue to update these things. And definitely the last year has kind of shown where I need to do that. But this guide also leads me into kind of the next level of involvement that you might be able to get into if you have the time and capacity in your area. The El Paso County Public Health Department organizes a youth suicide prevention working group through the county health department. I've been a part of the group since about 2016, because as Christine said in her section, El Paso County is one of those counties that has the highest suicide rate in Colorado. So there are lots of people working on all this. And this suicide prevention group is an example of that. It brings together all kinds of people, from school district administrators to the public health workers, data scientists, pastors, and youth therapists and all of that. In total, it's about 66 partner agencies. And then there's like 20 to 30 just unaffiliated parents or local members who want to join and help out. And we meet monthly and talk about these issues, talk about how we can be better at resource sharing. And I was able to bring this tough topics subject guide to the group as I was working on it. And I'm not a behavioral health expert. I have good research skills and stuff like that, but there's a lot of things that's kind of hard to wrap your head around sometimes, especially kind of a difficult issue like youth suicide. So I had the opportunity to bring this guide in to this group. They could review it, they could provide feedback and suggest resources and different things. And it's really been kind of taken on by this group as one of the main community informational sources that is promoted. And it's not just to teens, it's kind of grown from there. But it consistently gets like 600 or 700 views a month. So it's getting out there, and I think we're getting return users. So that's kind of taking our informational skills to the next level. But also just kind of being a part of this group is really cool, even though I'm not necessarily being a librarian the entire time I'm there. Sometimes we're just talking and having feedback, and we've got some really cool results from this group. And we've trained over 160 youth pastors in youth mental health first aid. And we've also established a school resource network that includes all of the schools in El Paso County. And you're probably not familiar with El Paso County, but we have 14 public school districts in one county. And then we also have a huge number of like private and independent schools. So doing anything coordinated with the school districts is a pretty big feat. And that's one of kind of the things that we're pretty proud of from this work. Unfortunately, in 2020, our suicide rate went back up to its all-time high again. But in the years previous, the number was coming down. I don't know if that's probably not a correlation just because of the group, but it's a community-wide effort that we can see the benefit of in our community. And so even if your local public health department doesn't have a group like this, I would suggest reaching out to that public health department just to see if they can offer, anything. If it's like, can you list some resources that we can put together on our website? you know, is there a way that we can get involved on helping the youth in our community? And also through this group has also led to other neat partnerships in our community. And that we can go to the next slide. This is an example that's kind of come up, I think, a few times in the chat a little bit. Through that suicide prevention working group, I was connected with the local chapter of the National Alliance for Mental Illness. It's called NAMI. It's a national thing. Definitely check their website. There's probably a chapter nearby. But the local NAMI in Colorado Springs had just completed an advertising campaign for the Colorado Crisis Services text line. And they'd done that through focus groups with local high schools, and particularly local high schools who had experienced these suicide clusters in the past. So we're really hearing from students who had been really close to these situations, maybe had friends going through all of this. And I think that really comes through in these example posters that are on the screen now. I think it does a great job of kind of succinctly addressing a lot of the pressures that teens are facing now, whether that's not feeling comfortable coming out to their parents, or the uncertain job landscape when they get out of high school, or the pressure to succeed in kind of everything they do. And I think it does a great job of addressing that. I was contacted by the local NAMI group, and we got to talking, and we were actually able to bring this campaign to all of our libraries. So all of our libraries have teen spaces in them, and we're displaying these posters throughout our teen spaces. We have little business cards that have the number to the crisis text line on it. And they're just kind of little visual cues that, as we've talked about in the chat, that the library is a safe space for these young people to kind of find the help they need, you know, open up a little bit if they need to. And we were the first non-school organization in the county to display these things. And this advertising campaign even got picked up by the State Department of Behavioral Health and was sent out all across the state of Colorado. So it's a really neat way to kind of see how some local work can kind of gradually build up and reach a bigger and bigger level. So those are kind of like medium work things, I guess I would say. But the last thing that we offer at PPLD is kind of the longest, most involved of the things that we do to support teen mental health. And in 2017, we joined the National Safe Place Network. Some of you may be familiar with the Safe Place Network, or your libraries might be a part of the Safe Place Network. They're big yellow road signs that say safe space on them. And what it means if a teen sees that sign is that they can come into our buildings and tell any library staff member, even if it's an IT guy who never works a public desk, if he has a PPLD name tag on, a teen can talk to that person and say they need a safe place, and that staff member knows what to do. And we're going to take them to a quiet area, ask them a few quick questions, and then we're going to contact our partner agency that is trained in behavioral health and mental health, who's going to send out a volunteer and talk to the teen right there, and talk them through the local resources they have access to, just kind of general information about what's going on. And it's all free. It's all 100% confidential. Nobody is going to call their parents after they use the Safe Place Network. And again, it's one of those big visual cues that the library is there to kind of support them however they need. I put it last on the list because it is kind of a pretty long, involved process to get it set up. You do have to pay a membership fee, and then there's also some like outreach benchmarks that you have to meet every year to keep your status updated. So that's definitely something that you might not have the capacity for, especially right now when we're still in kind of pandemic mode. But it's something to remember for the future if you want to, you want to keep taking your youth support to the next level. So I know I talked really quickly, but now I think it's your turn to kind of discuss some of the things that we've talked about. So what are some things that your libraries can or are already doing to better connect youth in our communities? And what are some other things that libraries can do to connect with our communities as a whole? And you can add those into the chat. Yeah, the safe place is pretty cool. But I think the outreach things might be a little bit easier if you're in a smaller area. But five staff's pretty small. So that one might not work, but hopefully you have those informational things. Yeah, you have to have part of the safe place is you partner with a local behavioral health organization who will send volunteers who have more training and things like that. It's really cool to work with them closely on these things, and we kind of extend their reach as well as our own, so. And actually, I'll say that after we joined, we actually got all of the YMCAs in the county to join. So it's kind of gradually growing that way as well. Yeah, displays are a great place to start. If you don't have kind of any of these things already, that's totally fine. But again, they're visual cues that you're there to support. You're showcasing a different part of your collection, things like that. For getting management on board, frankly, this is maybe not terribly helpful, but our management has kind of always been on board, which is a really nice place to be. I think maybe looking at the statistics in your area a little bit and kind of having a couple reasons, why this is a problem, even if you have some of those people in your area that are like, oh, we don't have that issue here. You probably do, and there's probably some evidence that you can find to support it. So again, that public health department, if you have one, any local health agencies that you could talk to is maybe a good place to start. And then you can bring that info to your management. Yeah, programs are another area you could go to support all of these things. Talking about having difficult conversations with friends, even something like recognizing the warning signs of somebody who's maybe thinking about suicide is a good one too. Yeah. Yeah, I think passive content is pretty important, especially if you have the place to display it, because it is hard to talk about no matter what your situation is. So kind of like all of these visual cues that the library is there for you, and that we're not gonna tattletale on you or something like that, because it can be scary to be that vulnerable with relative strangers. These are all great comments. There are definitely school social workers in the suicide prevention group that I'm a part of. I also do a lot of school outreach in my position. So sending links to like that tough topic subject guide is usually a part of something I include in all of my newsletters and things like that. It is a little difficult to work kind of directly with one school at a time because there are so many schools in our service district. But it was great to see them a part of that county public health group because they have different tools and different training as well that they're bringing. There's another system, I can't remember the name of it, like Safe to Tell or something. Is that one? Okay. Kind of a different system that they promote, and they have, different kind of school level things for it. Safe to say.
So we're starting to kind of get to the end of our session, but we wanted to, oops, sorry. Couple things as we have about 9 minutes left, but we kind of wanted to get you thinking about action planning. What are some things that you might be able to do? So that's kind of building off of some of the discussion before. But if you feel comfortable in the chat, maybe listing, one thing from the session that maybe you will share with your organization. It could be the archive of the session when it's available. It could be the handout, the stats, some of the stuff that Cameron talked about, and maybe one small thing that you could do in the next month. So feel free to add that to the chat. And then I think we can also open it up to questions at this time. And you can either put the question in the chat and we can answer it, or you can put it in the Q&A, whichever you prefer. And we can make sure that we get additional questions answered as we sort of move forward. And I'm going to go ahead and also then move to the last slide, which has our contact information, just in case people want that as well. But yeah, in the chat, go ahead and, talk a little bit more about some small steps that you can take and who you might share the information with, as well as questions about what you heard today.
Yeah, just taking a look around your area for youth serving organizations and places they can get help might be a small thing you can do in the next month.
Great. So many great next steps.
Yeah.
A lot of people are interested in the tough topics concept. Oh, and creating displays for Mental Health Month in May. So that's timely. This is great. The library's co-presenting a bullet journaling for self-care program this summer.
Well, that's nice.
So they can incorporate some of these resources into the presentation.
Very good.
And just sharing with coworkers, which is great. And you will be able to get a recording of this webinar as well. So if you want to revisit any of it, I posted the information there. And
Beth, if you have a second, if you want to go ahead and pop the handout back in, just in case somebody wasn't in
Sure.
Zoom. I think that's one of the things with Zoom. If you're not there when it's chatted, you don't see it. Our handout, once again, is intended to open for you as your own copy of the Google Docs. So feel free to take and share and whatnot. And then if for some reason you can't access it, you can email any one of us with the contact information on the slide, and we'd be happy to get it for you. Any other questions or thoughts?
So we have more people are looking at more partnering with the County Suicide Prevention Task Force and a lot of other great local organizations. So that's super.
Yeah, I think partnership is really key. You know, I think it's too often, you know, not just libraries, but other organizations too. We kind of think that we have to solve all of the problems ourselves when we could do a lot more by partnering kind of far and wide. So, and I think the kind of partnership that Cameron was talking about is a great example of like really what can happen when a lot of agencies can kind of come together.
Yeah, and one of my other coworkers works on a grant-funded suicide prevention group for like a more localized community, even within the county. So there might be these different levels that you can get involved in. They might not always have websites and stuff. So it's even partnering, you can get connected with lots of other people as well that you might not be able to find using web searching or something.
This is another great idea, partnering with public health offices, peer health educators to create some peer taught modules on mental health awareness and resources. Excellent idea.
That's an excellent idea, yeah.
And someone else is offering a taming anxiety meditation workshop in May. It's great.
Well, we just have a few more minutes left. So if you have any other great ideas or questions or thoughts, go ahead and pop them into chat. And then we do have a survey for you that I think Beth is going to pop in. And Beth, are you using ours or ARS, or not ARSLs, YALSA? Where am I today?
YALSA's survey.
Okay, cool.
It's been posted.
Excellent.
Yes, I assume we can share the slides as well. We can talk to our hosts at YALSA to make sure. But if not, you can also contact us directly. We're happy to share them.
Yeah, I believe she said the recording will have the slides and a chat transcript in it. So
excellent.
Oh, great.
That's good.
Excellent. Well, we are coming to the close of the hour, and we really appreciate everybody joining us today, and really, once again, taking the time to jump in and share your thoughts and ideas on a really tough topic. We've been able to share some great ideas and hear great ideas from you guys, and I think that's really what a lot of it is about, is just kind of getting the conversation started and seeing what we all can do when we sort of pull together. So we really appreciate you attending today. Any other thoughts or questions for the good of the cause? I'm going to go ahead and stop sharing my screen. It's weird being cut off from chat. But thanks everybody for attending.
This is Tammy. This is the one thing I do. I'm Tammy Diller-Stilson. I'm the executive director of YALSA, and I want to thank our panelists today for a wonderful session. And I look forward to you guys signing up and for the master class classes. And again, wonderful. I learned a lot, and thank you.
Thanks, guys. Well, I hope everybody has a really great rest of your day. Thank you so much for attending.